If you've recently suffered a humerus fracture or an upper arm fracture, I'm going to show you some tips you can do to improve your range of motion, your strength, and restore function to your upper extremity. The first movement that we're going to do is going to be pendulum exercises. This is an easy way to start range of motion without being too over aggressive and irritating the shoulder joint. Now, before you perform any of this, I'm going to assume that you're watching this for entertainment purposes or your physician has cleared you to start some sort of therapy program. So what you're going to do is you're going to let your arm, the affected arm or fractured arm, just kind of hang down. And what I'm going to do is kind of use my body. I'm leaning over here on the table, and I'm just going to use my body to create kind of movement with this side to side. And then we're also going to go back and forth. We can make circles with this. I typically don't count repetitions with this. It's something that you can kind of time it, maybe do 30 seconds, 60 seconds, and do that in each position. That's something you can do several times a day. Next, we're going to progress to an overdoor pulley. Now, you can order these different locations. I'll put a link in the description for these. These are really good to start the range of motion, reaching overhead. This is better alternative initially than, kind of sliding your hand up the wall, because what I can do is I can use my right arm, which is going to be my non-affected arm, to pull my fractured side up. And I usually have patients just set a timer with this, maybe do this for around 5 minutes or so, even working up towards 10 minutes. You can vary the position on this. You can bring this out to the side and work on more of an what's called abduction movement, or you can keep it more in flexion or in scaption, just kind of play with it. At the end of the day, we're just working on raising the arm overhead. So this does really well and gives you a lot of control over how far that you want to go. Our next range of motion exercise is going to be a tabletop slide. So what you're going to do with this is you're going to take a towel or a pillowcase, put on top of a table or a countertop, put your affected hand or affected side down on the towel first, and take your other side that's not fractured, put it on top, and work on sliding back and forth. This is something you can repeat for a period of time, maybe 1 minute or 2 minutes, or maybe you want to count repetitions. Either way is fine. Then you also can take this and go side to side with this. So you can go to the front, and then you can also go side to side, just kind of working on going across. You can make circles with this. All of those movements are fine to try to work on starting to restore some of that range of motion back to your shoulder. As everything continues to progress with your range of motion, you're going to want to start using a cane. You can use a piece of PVC pipe. You can use a cane that you have around your house, a broom handle, all that works fine. What you're going to do with this is you're going to raise the arm overhead as high as you can. I'm using my right side, which is my non-fractured side, to help my fractured side up as high as I can and then back down. And then you're also going to do this out to the side. So you're going to take your hand, put it on the end of the cane here, using my right arm to push the left side out to the side. You repeat each one of these for a couple of sets of 10 to 20 repetitions. Now we're going to start our strengthening exercises. This is going to be a scapular retraction or a row using a band. What I'm going to do is just pull the band back like this. I'm going to pull it back as far as I can, really contracting all the muscles in the back side of my shoulder here. I'm going to pull that back for around 2 to 3 sets of 10 to 15 repetitions and repeat that 1 time a day. Taking that same band, we're going to work on external rotation. Now initially, your external rotation, you're not going to be able to pull your hand out to the side like that. It's going to be, you'll be lucky to get it to kind of an even spot here, let alone go out to the side. So what I have patients typically do is take the band, fasten it over to a stable surface, and we're going to do walkouts. So I'm going to step out and then step back. This is a good isometric exercise where there's a muscle contraction on the back side of my shoulder, but there's no joint movement. And then as that becomes more tolerable and I'm getting stronger, then I'm going to work on actually bringing my hand out to the side. A lot of times I have patients hold a towel between the elbow and their side just to kind of stabilize and make that a little more focused as far as the rotator cuff. You also can go into using machines, a cable system. So if you have a cable system, I do like cable systems with that. I definitely wouldn't stay on bands forever. You have to progress more to a cable system or dumbbells, other more strenuous things to return full function. But I like to start out with a band because 1, they're easy to use, and 2, they're pretty accessible to get. I'll put a link in the description also for a set of these bands. Next, we're going to work on internal rotation. We're going to do that same way as far as the step out or walk out, elbow by my side, have the band in my hand. I'm going to step to my right, and then back over, step to my right, and back over. Again, just like the other exercise, as I become more confident with this, I'm getting stronger. I can work on actually making the movement happen, bringing my hand in towards my abdomen. Repeat that for around 2 to 3 sets of 10 to 12 repetitions. The last exercise, we're going to perform a bicep curls. I'm standing on this band. I have it under my foot. I'm going to work on just curling up the band, up and back down, repeating that for 2 to 3 sets of 10 to 12 repetitions. We want to make sure to include the bicep strengthening with this because a part of the bicep tendon, the long heads tendon, does cross the shoulder joint. So that can be beneficial when working on trying to reach overhead and out to the side with our upper extremity. As always, you can apply moist heat or ice packs either before or after you go through your program. That's okay. Anything that improves your ability to go through your strengthening program and your range of motion. Just make sure that you clear all those things with your doctor to make sure you're safe to do so. Thanks so much for watching. If this video helps to improve your range of motion, pain, and strength of your upper extremity, make sure you hit that subscribe button so you can stay up to date on all my content.